All right, so are there unmet needs in lupus and lupus nephritis? Oh, absolutely. Let's go back to 1950, and that was not that long ago. So remember that compound E, steroids, came about in 1948, and I think first used in lupus around 1950, 1952. But the outlook for someone with lupus was miserable. The 7-year survival at that time was 50%. So remember, we didn't have dialysis and we didn't have steroids. But now we are in the modern era with state-of-the-art drugs. So what do you think the mortality rate at 15 years is right now? There are your options. This is not exactly audience response, but you can think the answer to yourselves. So you would hope it's close to 0%, but it's not. In the modern era, we're still losing, as Dan said, about 15 to 18% of our patients at 15 years. Now, you heard about damage. And the name of the game in lupus is to prevent damage, and I'll show you why. This is from an article published by Murray Urowitz and his group in Toronto. And entry into their cohort, they looked at SLEDAI score, prednisone dose, and the damage score, and then looked at the percentage of patients who accrued more damage over time at 1 year and 5 years. And you can see at the top, if you had very active disease by the SLEDAI, you were more likely to accrue more damage than if you had a lower SLEDAI score. And if you came in on high doses of prednisone, greater than 7.5 milligrams per day, you were more likely to accrue greater amounts of damage. And if you came in with damage, you accrued more damage. So damage is a very important concept, not just in lupus, but with every disease. So you could simplify this: activity begets damage, damage begets more damage, and more damage begets mortality. And this is a meta-analysis published fairly recently. And the conclusion from this study was that for each point increase in the damage index, and it's not hard to go up by 1 point. So for each 1 point increase, there's a 34% increased risk of death. And then we have the comorbidities. I mean, it's a lot to think about when you see a lupus patient, especially if you're seeing that patient in about a 15 minutes time slot. You're addressing hypertension and diabetes and all the side effects of steroids. And on the right-hand side, cancer risk and bone health and reproductive health, and the list goes on and on. So what about mortality? I told you what the stats were back in 1950 and what they are now. So it is true that the mortality rate has decreased, but it's decreased less than the age standardized mortality rate. And we lose patients early on because of infections and later on because of cardiovascular disease. And a very interesting statistic is that those aged 15 to 24, lupus as a cause of death ranked #1 among chronic inflammatory diseases. And we just heard some disheartening news at the ACR meeting that for lupus nephritis, the age standardized mortality rate, which seemed to be dipping, actually rose between the years 2015 and 2019. And then at the bottom of the slide, you can see some statistics about lupus nephritis. And Maria Tectonidou from Greece reminds us that over 40% of our patients with class 4 diffuse proliferative nephritis go on to end-stage kidney disease at 15 years.